What if I told you there was hope for when your child receives a psychological diagnosis and that you, the parent, could play a big role in it? Okay, so one of my biggest frustrations and one of the hills that I will die on as a clinical child psychologist is this: we should not be sharing psychological disorders with teens or kids. Here's three reasons why. First reason is self-fulfilling prophecy. It's a psychological construct that usually shows that that kids are going to, or anyone for that matter, is going to obtain what others perceive them to become. So if we think, oh my goodness, they're going to be a great kid, chances are they're going to kind of look for all of the evidence that means that they're a great kid and then continue to go that. If we're like, oh, that kid is a bad kid, labeled as a bad kid, well then guess what? They're going to show you just how bad they are. All right, so that's self-fulfilling prophecy. Reason number two, developmental stage, especially for teenagers and young adults, like emerging adults, 18 to 25. This is when they are developing their identity. They're trying to figure out who they are. And if we come in as a psychologist or anyone for that matter, or like a parent or a teacher, and we place a label on them, like a psychological disorder, well, man, it's going to become part of their identity, just like it did for one of my clients when I was on internship. She walks up to me, I meet her, I'm like, hi, I'm Andrea, blah, blah, blah. She reaches out her hand, she goes, hi, I'm Molly. I have bipolar disorder. And I was like, oh, and she did the same thing to my supervisor. But here's the thing. She didn't even have bipolar disorder. She was misdiagnosed when she was 4 years old. And now 10 years later, it's still part of who she is. That's another reason why we do not want them to know what their psychological disorder is. Another thing is that they start to perceive it as a way that they cannot overcome it. It becomes it's more of what we call a disease model. It's fatalistic. They're like, oh my God, I can never do it. And in my experience, there's two types of people when they receive a psychological disorder. There's the fighter, the person that's like, okay, yeah, you gave me this diagnosis. I know what it is. Let me go do all the research on it and then let me fight it and let me overcome it. That's my friend Eric. As soon as he found out that he was bipolar disorder, he's like, finally. Oh, there was a huge relief, and he knew exactly, there was an explanation for it, and he has been able to overcome it, and he's living a great life. Then there's the victim. They're the second part. They're the ones that are like, it's a crutch. It becomes part of their identity. It becomes who they are. And they start to make excuses. And it becomes they develop learned helplessness, which just means like, oh my God, I have bipolar disorder. I can't do anything about it. And it becomes excuse after excuse after excuse. And that's just not how psychological disorders work. Because the vast majority of psychological disorders, in my experience, go away with proper treatment. Now, there are some exceptions. There's like schizophrenia and there's bipolar disorder, but the vast majority of them, depression, anxiety, oppositional defiant disorder, conduct disorder, OCD, those are all disorders, and except for in rarest of cases, all those can be treated. All of those can go away, and you can learn skills and coping skills, and you can overcome them, and it goes away, and the child no longer meets criteria for it. And that's great. And that's the kind of mentality that I want us to have for these kids, is because there's so few disorders in my experience that can't be treated. Like schizophrenia, if you have schizophrenia, chances are you're going to be dealing with it and having to navigate it for the rest of your life. So what can we be doing? The other thing is, the other reason why we don't want to do psychological disorders, I know I told you 3, but here's the other thing. All of these 3 combined, we're communicating to the teen that they are broken, and they are not broken. They just need to develop more skills. So if your child develops a psychological disorder, how do we want to handle it? We want to treat it like any other experience or skill. We want to assess it first, and then we want to develop a plan to attack it. So when I am working with teenagers, I'm like, okay, so instead of looking at them and being like, oh, you have generalized anxiety disorder and it will never go away, Malarkey. I typically do not tell teenagers what their diagnosis is. I don't tell kids what their diagnosis is. I simply say, okay, so hey, you're experiencing nervousness, you're experiencing scared, you're worrying a lot, and it's getting in the way of your life. We don't want that. And here's the other secret. Guess what? The only real use for psychological disorders is insurance purposes. That's the only reason why I diagnose kids or teenagers or anyone for that matter, is because unless there's a diagnosis, the insurance will not cover it. But I usually don't, like I said before, I usually don't tell teens or kids or anyone for that matter what their diagnosis is unless they specifically ask. In my head, I have a diagnosis because I have to write it down for insurance purposes, but usually I'm not telling them. So what I usually do, it looks something like this. It's like, okay, so you have like in my head, I'm like, okay, they have generalized anxiety disorder. They're meeting criteria for generalized anxiety disorder. They're worrying all the time about everything, and it's been going on for 6 months, and they're having sleep disturbances, and they have muscle tension, and it's causing a lot of guilt and fatigue and all of the things. That's generalized anxiety disorder in a nutshell. I'm going to look at the teen and be like, okay, so you have nervousness, you have worry, usually the worry, and it's getting in the way of your life. Let's fix that. Let's make that go away. I'm like, okay, we're going to have 4 steps. I'm going to give you psychoeducation. We're going to tell you what anxiety is, what nervousness is, what worry is, what that emotion looks like in your body. Second thing, I'm going to teach you relaxation skills because our bodies cannot be relaxed and anxious all at the same time. So we need to teach our bodies how to relax. Third step is we're going to teach you cognitive skills. So how do you fight, combat the mind anxiety that's going on, that what if thinking, like catastrophizing. Oh my God, the world's going to end and I'm going to do this and then this and then this and then this. And then I'm going to end up and be a troll forever. And it's like, oh my goodness, no. And then the last step is like, we're going to face your fears. And that's what I would do as a psychologist. That is not what you are doing as parents. What you are doing as parents is if your child gets a psychological disorder, you're going to communicate to your mental health provider or the doctor, whatever it is, and be like, you're going to tell them this in private and be like, hey, I don't want my child to know what their diagnosis is. Their brains are not yet developed for it. They cannot handle that. We do not want it to be part of their identity. We want them to think that that they can change and that they can get better and they are successful and they are adaptable. We do not want them to think that they are broken, that they cannot be fixed, and that they have this thing and they're always going to have it, because it's not true. And so for you as parents, that's what you're going to do. You're going to advocate to mental health providers and doctors, and you're going to say, hey, I don't want them to know the diagnosis, and we're going to just treat it as such. And then when you guys are having conversations, it's not coming up. You're like, oh my God, this generalized anxiety disorder is killing me. No, you're going to keep that filter, people. You're going to keep that in your own head. You're not going to share it because you are protecting your child. This is what you're protecting them, to allow your child freedom to become who they are meant to be. And that is not someone who is broken. That is someone who's adaptable. So by keeping them protected, giving them the freedom to live their life diagnosis label free, we are going to be throat punching this youth mental health crisis. Let's go.